Millions of different people every day use drugs for millions of different reasons. There are medications for sickness, medications for pain, and even medications to just make certain aspects of health easier to manage. One of these types of medications is commonly referred to as birth control. There are many different types of birth controls available to women in the United States. Some of these birth control options include an intrauterine device, commonly surgically implanted in the arm. Typically, however, most people in the United States usually take a birth control pill rather than going for the surgical route. Despite the differences in terms of how they are inserted, they all use some variation or mixture of hormones to regulate pregnancy and menstrual cycles. The chemical we are focusing on is a synthetic hormone. The chemical name is ethinylestradiol. The chemical formula is C20H24O2 with a weight of 296.41 grams per mole. It is classified as an estrogen, which is one of the most common hormones used in birth control. When ethinylestradiol combines with progestin, another hormone which prevents ovulation during pregnancy, the result is commonly known as a contraception pill. Dual usage of ethinylestradiol and progestin methods are usually more effective than just merely taking one or the other. Birth control is regulated just like any other medication. Synthetic hormones are used as birth control, which prevents pregnancy by increasing the thickness of the cervical mucus to prevent sperm from entering the egg. This has also the added effect of preventing ovulation from occurring. In 2009, ethinylestradiol is still being used as the primary synthetic hormone. However, the amount of progestin used in conjugation with ethinylestradiol was decreased, as decreasing the number of hormones did not affect the result of the drug. Ethinylestradiol has many different side effects, such as the assistance in preventing menopause and long-term protection against breast cancer. However, there is a risk of endometrial cancer that occurs within the subsequent increase in estrogen. This drug also increases the risk of stroke, liver tumors, gallbladder disease, and/or fetal abnormalities. There is an increased risk of cardiovascular disease if a patient smokes while taking this drug, though smoking does offer its own problems in regards to health. Though this combination has proved to be advantageous, birth control has not always been this effective or easily obtainable. Originally, birth control pills were not used in moderation. Pills today are given in only 20 to 35 micrograms per dosage, as opposed to the 100 or 150 micrograms per dosage in the 1960s. If a woman in the 1960s could obtain birth control, she would take in large doses that are unheard of nowadays. The 1960s, while on the topic, is particularly relevant when regarding discussions surrounding ethinylestradiol. Ethinylestradiol was a revolutionary drug because women did not have to worry about unwanted pregnancies during the sexual revolution that blossomed during the 1960s through the 1970s. This helped shape